Hey everyone, it's Dr. Rick with an Herbal 411 Highlights. So it's Sunday today, and I want to thank all my patients and new subscribers that came out to my lecture yesterday at the Endorphin Effect. Great questions, great answers. I'm going to post answers to these common questions because I'm sure some of my viewers have the same questions. I'll post them next week as I formulate some video editing. But today, I wanted to do one on COVID-19. Because 3 of my healthcare workers that came yesterday already got their vaccines. One had the second shot. So there's a lot of talk about other people who aren't able to get the shot just yet, the direction, the predicted decrease in the surge, side effects, can I exercise, can I not exercise? So I'm going to be donating my convalescent plasma today, Sunday. If you have been infected and you're a patient of mine, or even if you're not a patient of mine, please consider donating plasma because in my opinion, it is now January. I think we have about 6 months of damage yet. And if you follow IHME, that's the website that predicts, the Bill Gates Foundation is funding it. I think it's neutral, but the data collection is robust and I think it's spot on. If you look at how they collect the data, they show a progression of disease and death still into April. There's pushback because even in the healthcare industry, some people don't want to get, and I think it's about 30%, do not want to get the vaccine. So hopefully we'll get more information out there. This is to serve as giving you information. So the idea is that if you do have the infection and antibodies, that's IgG antibodies proven by my test that I did for you, or you just have the positive test that you got infected, you don't even need the antibodies, but you can get a free antibody test if you want afterward. The idea is to put that convalescent plasma out there for the unfortunate. There's a lot of people with comorbid conditions that won't do as well. If you lower as much as possible your comorbid conditions like high blood pressure, elevated glucose and prediabetes, obesity, smoking, if you lower all those risk factors, you will fare better. I mean, you should be doing that anyway, just to beat cancer, heart attack, and stroke. But since we're still in the midst of the highest part of the pandemic, even since last year, do your best. Masking, distance, washing hands, always important. But until we get into April, May, June, we still have a fight. I'm going to show you real quick how I would do this because I checked out Red Cross and Versity and Vitalant. Those are the places in Illinois where you can donate, and the easiest I've found, at least in my area, is Vitalant. Red Cross, the only place they have is Chicago. That's too far for me, and you got to pay for parking, I think. Versity, I've been having a toughest time. I know they're probably good people, and they have a lot of centers, but I just can't get scheduled. So I just went on today and got this one. So let me show you how. So this is Vitalant, and all you do is go to their website. You click on Donate, and you go down to the menu to Convalescent Plasma, and you go down here, Schedule Now, and we're going to pick, there's a couple different places. I'm going to Arlington Heights, so that's not available for the demo. Let's go to Lake Bluff. You pick Submit, and then here you have unavailable. First, before scrolling through, I got some green here available, but see all the different blood you can donate? I would click on convalescent plasma, so suddenly everything disappears, except for one. So they have a spot at 11. Convalescent plasma, the date today, you click on that, and here you can see, make an appointment. That's awesome, it's so easy. I can't click on that because, well, let's see what happens. Yeah, you got to fill out something. I didn't want to click on it because I might have to register and it might screw up my other appointment. So this is my confirmation of appointment today. That's pretty cool. You don't have to print this up, but I always would print this up. I would just in case print up. There's a release form too that you can get on Vitalant. It probably speeds up the process. And they did not ask me, but it's probably a good idea you have the print up of your nasal swab that you had. My warriors who got the infection and nailed it, or my long haulers who got the infection, had persistent symptoms but got better, please consider donating. It takes 45 minutes. You're supposed to eat. Don't fast. Take a lot of fluid. I'm tanking up on my tea. I actually made a mistake because I went to the Schaumburg one. I was scheduled for 7:30 today, Sunday. But I'm an intermittent faster. I usually don't eat until 12, and I went through the questions with the interviewing nurse or tech, and she said, when was the last time you had anything to eat? Did you have a big breakfast? I said, well, I don't really eat breakfast. And she said, whoops, because there's a protocol. Protocol is you have to eat. They're afraid that you're going to go hypotensive because they take out about, I guess, 500 cc's. I think. I'm going to confirm that later. 500 cc's, it's not that bad. We all have about 6 to 7 liters. So if you take out 500 cc's, that's half a liter. It shouldn't affect you. However, some people just with needles are a little needle phobic, and that'll cause their blood pressure to bottom. And then what's going to happen is that'll trigger them to think they have to get you to the emergency room, and they're trying to stop the occasion. So try to eat something, take a lot of hydration. I wouldn't do caffeine. Well, you have to be careful. Caffeine, if it's your usual thing, fine. But caffeine makes you pee, and you don't want to be on the empty side when you donate blood. I think there are some really good things when you donate blood because it stimulates the body to produce more from your bone marrow. But I have some patients with polycythemia vera who have to donate once a month, once every quarter, and they feel great. People with iron overload, same thing. So the idea is that it's for a good cause. There are some people who are unfortunate. I know 2 that died. They're relatives of a patient of mine, and it's a shame. But even with sheltering, these 2 people, they stayed in their room. They controlled exposure, even holiday exposure, but they still got it. Maybe through the vent system. I'm not sure. It's so hard to say. I got it because I was exposed to one guy at Ace Hardware that coughed on me. Sorry, Ace Hardware, but that's my interpretation of where I got it because I traced it backwards. I wanted to talk about how this vaccine works. Pfizer and Moderna, they're coming out with vaccines. And Pfizer combined with BioNTech, and they've had funding, but they got more funding from the government. Moderna is a smaller company. They got funding from the government too when it went into warp speed. Now, they produced the proper vaccine, and this is how you have to hear about vaccines. The chatter online about autism and vaccines, I think it's valid, and I honor the parents who had an association between a lot of the injections and the beginning of autism. The data has been robust as far as disqualifying that. I'm not disqualifying the sensitivity of this topic. However, here's the safety thing. When you go through approval of vaccines, you have to have information produced. Even if it's an emergency authorization, you still have to have information produced. They have to go through the usual phase 1, phase 2, phase 3, and then sometimes phase 4. However, when they pass through phase 1 and phase 2, it's considered relatively safe. When they go through phase 3, which both of those companies that are releasing the mRNA have gone through, they started injecting mostly healthcare workers in the summer, part of their test subjects. And there's limited side effects. The biggest side effect, as you've probably heard already, is allergic response. What we want to do is decrease the overall death, at least in the United States and all over the world. So that's when you have to have, if you can get 70% of the humans in the world to get the infection, or at least to have antibodies to the infection, you should be able to at least decrease the bottleneck in the hospital. The problem is when your saving graces are going to be the hospital. Then if you have the infection, even if you have smoking and diabetes and cancer and immune issues, if you get to the hospital can support most people to get them through the infection, control the cytokine storm, and get them off the ventilator. I know you'll hear stories that people get on ventilators and they die. That's not entirely true. When you can have a team focused on you and a ventilator focused on you, the likelihood is you will be able to make it through everything. It might take time. There's not a guarantee, but here's what I'm getting at. When you have 70% of the population, the vaccinations theoretically will decrease the symptoms. That you get the infection from the vaccine, but you'll decrease the symptoms because of the antibody response. It's called humoral immunity, cell-mediated immunity. When you get the vaccine, it stimulates the body to react, both with attacking. The fast reaction is attack the cells or the pieces of the virus that you get. Now, if you get a piece of the virus, you don't technically have the infection, but you just get a little bit of almost like bait. You coax the little white blood cells to bite the bait, and when they bite the bait, all the other white blood cells respond. When they respond, they have memory, and they'll calm down after everything is taken care of, and the body figures, okay, it's not really the virus, but we'll calm down. But when you calm down, those memory cells get put into the closet, so that if you actually get exposed, memory cells come out again, and they start fighting before you get to massive cytokine storm. So that's how a vaccine works. Both the cell-mediated, which is what I talked about, you attack the cell, the piece of the virus that you're getting, and humoral. Humoral is when you have antibodies that are launched. When the body is spectacular with its immune system, and when the immune system senses a fight, it tells the bones, the spleen, the liver to produce, and lymph nodes to produce antibodies. It specifically makes an antibody for the targeted antigen. Antigen is the piece of the bad guy. The antibody is the little white blood cell that attacks and gets memory and then eats it and everything else that looks like it. So we want IgG antibody, and that's why I'm donating the plasma today. And the hope is that if you have those IgG antibodies with future exposure, anytime you have any of the carriage of the virus, you will not get sick. So that's the way it works. The question on the vaccines and how vaccines are difficult to make, but they are safe. I really think they're safe, especially if you're healthy. So please work on your comorbid conditions. But you have to have a matchup, the proper matchup. And that's what these companies try to figure out. They match up which piece of the virus are they going to try to produce. They don't actually take the virus, they reproduce a piece of the virus. And in this case, in most cases with the mRNA, they're reproducing a piece of that spike. That spike on the outside shell that binds to a receptor inside your body on the respiratory tract. That spike, if you can reproduce the spike, you mimic that piece. And then that's the antigen part. And then you combine it with an adjuvant. So you have to have an antigen, that's a piece of the virus, and an adjuvant. The adjuvant is something that stimulates the immune system to notice there's something going on. Because if you just give a piece of the virus, especially if it's just a piece, it might not mount a response. So you have to have a stimulator, adjuvant. And that is the problem, or that was supposedly the problem with the old vaccines that led to autism. They were worried about the mercury. And the movement was strong, although the data was questionable. The movement was so strong that most of the companies said, okay, we're going to take all the mercury out. And then I think they said, we're going to take the mercury lookalikes, thimerosal, out. They still have to have you have to have an adjuvant. At this point in time, I think the mRNAs are using aluminum or an aluminum substrate as an adjuvant. But once you have the adjuvant, once you have the right antigen, you match them together and you put it in the vaccine. You're hoping that the body will respond. There's a couple of problems, and that's how they have to figure out which piece of antigen and which adjuvant. If you have the wrong piece of antigen, it might give a subclinical response. So you'll have the vaccine, you might have aches and pains and fever, but you won't have enough antibody produced. And you want to have memory antibody, IgG, for a long time. That's called durability. If you have IgG, but it goes away real fast, you're not protected. If you're not protected, you'll still have a potential nasty response that'll send you to the emergency room that'll bog up the funnel. So, and that's when people die. Again, when you have a one-on-one team that's watching you and carrying you through your cytokine storm or calming down the cytokine storm, you'll probably make it. Our ICUs are fantastic. The United States is fantastic with their high-intensity stuff. There's a problem with the low-intensity stuff and exercise and nutrition, but I'll get to that the next week with my videos. But the problem is if you have all the ventilators, all the doctors stressed out and tired, all the nurses totally tired, doing double shifts, that's where mistakes will be made. So the mistakes result in death. And it's not an intentional mistake. It's just that if you have to take care of 10 different people, 20 different people, you can't tend to the nuances of blood pressure and infection and fever. And if you have to watch over the entire flock, your attention to one or several people might go unnoticed. So that's why we have to decrease the total severity. And that's where these two vaccines are useful. The efficacy of the vaccines was based on decreasing total severity of symptoms. And that's what you want to do. So there's a whole bunch of different vaccines coming out, and that's probably another video. But for now, I'd say have faith. I think that even if you're an athlete and you haven't had infection, if you want to prove it, call your doctor, call me, or become my patient, and I'll order an IgG test for you. If you already have an exposure and you didn't know about it, and it was just like one day, and you have the antibodies, you're cool. Donate blood. Maybe you should still mask, wash hands, and distance. But if you are hesitant, at least test. And if you know that the IgG is negative, you're going to please consider getting the vaccine. Still keep up with healthy lifestyle, but get the vaccine, because the more people we have with vaccine, and the less likelihood that we swamp the hospitals, and that's what we want. I want to unload the pressure to my frontliners, immediate care guys, my emergency room guys, my intensivists, and my nurse staff. So emergency room, God bless them. They're really enduring a lot, especially in California right now. If you follow IHME, that's the Bill Gates Foundation website, they've been following and manifesting a pretty good protocol for figuring out what the projected infection rate is. And they have a peak occurring up until April. I don't think they have the data after that, but we're not done with this crap. So, and it is dependent on continued mask wear and the vaccines. If we had rapid rollout of the vaccines, you'll see that the projected infection rate goes down. So please maintain your diligence at this point in time. If you're positive, if you were infected, please get your IgG test, or just go ahead and donate with Vitalant or Red Cross or Versity. They're all good, but Vitalant was just easier to reschedule. And hopefully we'll make it through this, and then we can start planning on getting rid of that extra 15 pounds and the muscle fatigue that we all endured in this last 9 months. We got to make this change now. I'm looking forward to 2021. If you have any questions, then post them down below. If you don't have a doctor and you're not sure what to do, or you haven't been infected and you want to maybe have ivermectin or Zithromax on hand, come see me. Be my patient through my website, Herbal411. I'll put a link down below. Or ask your doctor. But as far as I know, a lot of my colleagues aren't doing any extra prescribing. I called 2 pharmacies on ivermectin, which I think is great because of the guys, the intensivists at Virginia, and nobody's prescribing ivermectin. I'm like, what? Come on, repurpose. It's so cheap, $25 versus the recombinant. Never mind. So protect yourself, protect your families. Say some prayers that we get through this crap and get rid of those comorbid conditions. Donate if you can. I'll see you at the next video.